Hello everyone, my name is Sophie Van Osdale. Today I will be presenting on the immune system, a condition called celiac disease. In general, the immune system's job is to protect the body from harmful bacteria, viruses, and any other foreign substances that may be within the body. In an autoimmune disease, however, the immune system mistakenly attacks the body's own tissue rather than a foreign substance, virus, or bacteria. Celiac disease is an example of an autoimmune disorder, meaning that the body's immune system mistakenly attacks the healthy tissue within the body. In this specific case with celiac disease, eating gluten is the trigger. Gluten is a protein that can be found in wheat, barley, and rye. This triggers an immune response within the body. Instead of simply digesting the food like a normal digestive system might, the immune system rather attacks the villi that line the small intestine. Villi are tiny finger-like projections within the lining of the intestine. These act to absorb nutrients, vitamins, and minerals. Those are all taken up from the food that we eat. During this immune response, the body attacks these villi, and as they become more damaged, the intestine cannot properly absorb nutrients, which leads to malabsorption. Researchers believe that both nature and nurture come into play, that being that genetics and environmental factors which contribute to the disease. Genetics being it runs in the family. People with a close relative who has celiac disease are at a much higher risk of having it or developing it. The disease may also develop later in life, such as after surgery, pregnancy, childbirth, viral infections, severe stress, really any time that the immune system may be weakened or especially compromised. It's also a lot more common in people with other autoimmune conditions, such as like type 1 diabetes as well as thyroid disease. Symptoms can really vary from person to person. Many adults can experience digestive issues such as diarrhea, abdominal pain, bloating, excessive gas, nausea, vomiting, constipation, fatigue, unexplained weight loss. However, more than half of the adults have symptoms that are not directly related to these digestive issues. Due to the damaged villi not being able to absorb nutrients properly, patients may develop anemia from iron deficiency, as well as osteoporosis from poor calcium and vitamin D absorption, mouth ulcers, headaches, joint pain, numbness or tingling in the hands and feet, balance and coordination problems, elevated liver enzymes, and a skin rash is very common, which is called dermatitis herpetiformis. As usual, children often present differently. They more commonly have chronic diarrhea, constipation, swollen abdomen, or bloating, pale, particularly foul-smelling stool, poor growth, delayed puberty, irritability, short stature, tooth enamel defects, as well as developmental and learning issues. In really severe cases, children may experience failure to thrive because their bodies cannot properly absorb the nutrients that are necessary for normal, healthy growth. The pathophysiology of celiac disease begins when gluten enters the digestive tract. So a person eats a bowl of pasta, the gluten travels into the small intestine, and in some people, nothing happens. But in someone with celiac disease, the immune system mistakenly attacks the gluten, which ends up damaging the villi within the lining of the small intestine, which eventually makes it very difficult to absorb nutrients. When the immune system identifies gluten as harmful, it produces antibodies that attack the lining of the small intestine and the villi. So the antibodies latch onto the villi and then they release chemicals which are aimed for removal or destruction of them, which causes them to deflate or flatten and eventually die off. This immune reaction gradually destroys this intestinal lining of villi. Without these healthy villi, nutrients such as iron, calcium, folate, and many vitamins, among many others, can't be absorbed efficiently or at all. This leads to malabsorption, causing nutritional deficiencies that affect multiple body systems. Even when a person is eating enough food, their body may still become malnourished because the nutrients are not properly being absorbed to enter the bloodstream for use. Healthcare providers may diagnose celiac disease using a combination of blood tests and medical procedures. The blood tests will look for antibodies that suggest an autoimmune reaction to the gluten specifically. Most commonly is TTGI-IgA, which is tissue transglutaminase antibody, which is due to a reaction to consuming gluten. And an endoscopy paired with a biopsy of the small intestine can also be administered to confirm the damage of the villi. So patients should continue to eat gluten before testing because removing this gluten beforehand can produce a false negative, just because the lining has the capability to repair itself. So if there's no damage being made to the villi, then it will be better than it is. Currently, there's no cure for celiac disease. There's not really treatment other than dietary. So the only effective treatment so far is just to maintain a strict gluten-free diet, and this is a lifelong thing. Eliminating gluten allows for the small intestine to heal, it reduces inflammation, and improves the nutrient absorption. This can also be accompanied with vitamin and mineral supplementing to correct these deficiencies caused from the malabsorption. Often a registered dietitian will often help patients learn how to avoid hidden sources of gluten, as well as to maintain a balanced diet through supplementing. People with persistent symptoms, despite following the diet, may require additional testing to identify accidental gluten exposure or just another gastrointestinal disorder or autoimmune disorder. When left untreated, it can lead to several incredibly serious complications. Long-term malnutrition can cause anemia, osteoporosis, osteopenia, infertility, miscarriage, delayed growth in children, lactose intolerance, permanent nerve damage known as peripheral neuropathy. Patients who continue eating gluten also have an increased risk of developing intestinal lymphoma and small bowel cancer. So it's very serious that it gets treated, and as well as caught early on. That always helps. Some patients develop non-responsive celiac disease. This means that symptoms continue despite following what they believe is a gluten-free diet. This is often the result of hidden gluten contamination, another digestive disorder. And in some rare cases, patients can develop refractory celiac disease, which is where the intestinal damage continues even after following a strict gluten-free diet for several months. This can just be telling of how severe the intestinal villi damage is, based on how much damage the immune system has done. The prognosis for celiac disease is generally pretty good, especially when it's diagnosed early and it's managed with the lifelong gluten-free diet. Most patients experience symptom relief within weeks. The small intestine can take several months to years to fully heal from the damage, but it is attainable. Following the treatment plan definitely greatly reduces the risk of long-term complications, and allows most people to live a really healthy, active life, but it definitely does not guarantee remission or really anything similar.